Hello, everyone, and welcome to the SNAP's COVID-19 office hours. My name is Micah Webster with Apt Associates, and I'm going to spend a couple of moments going over some tech notes, and then we'll get into the content that we have for you today. A couple of housekeeping reminders. We are recording the office hours today, as we do for each office hours. We'll post a copy of the recording along with the slides and any content that we receive through the chat box onto the Hud Exchange in just a few business days. If you have any issues with audio during the webinar, we encourage you to switch over from computer to phone audio at the numbers that are up there on the screen and that I've just entered into the chat. Everyone will remain muted for the duration of the office hours this week, but we absolutely anticipate and hope to hear from you through the chat feature in WebEx. To find the chat, just take a look at the bottom right-hand corner of your screen, and you should see the word chat and what looks like a message bubble. Click on that to open the chat. Please send all questions, comments, and feedback through the chat. And with that, I'm going to turn things over to Norm Suchar from the HUD Office of Special Needs Assistance Programs. Norm?
Thank you very much, Micah, and welcome everyone to our office hours session today. As always, we have a lot of great content we are very excited to share with you. I'm going to walk through our agenda for today, and then we can go right into the content. So we'll be hearing from Caroline Waddell from the Centers for Disease Control and Prevention with an update on both COVID and monkeypox. Later, we will hear from Heidi Schulp and Karen de Blasio with an update on ESG-CV spending and how things are going with ESG-CV. And finally, we will hear from Ashley Kerr with some great technical assistance resources focused on winter planning and isolation and quarantine. As Micah mentioned, we would be delighted to respond to your questions and comments. Just type those in the chat window, and we have a great team of snappers here who are going to jump in and try to answer as many questions as we possibly can. Just please make sure when you are typing in the chat window, you make sure it says to everyone so that everyone, including we, can see your questions and we will respond likewise. So again, want to thank everyone for joining. And with that, I'm going to turn things over to Caroline from the Centers for Disease Control and Prevention. Caroline, take it away.
Hi everyone, just like Norm said, my name is Caroline Waddell and I'm an Epidemic Intelligence Service Officer in the Homelessness Unit at CDC. And today I'll be giving an update on the state of COVID-19 and MPX in the United States. Next slide, please. Starting with COVID-19, this figure shows new admissions of patients with confirmed COVID-19 over time, and there have been over 5 million total admissions so far. Hospitalizations have been in steady decline since late July 2022. That's a hopeful sign. Next slide, please. And the map on this slide shows updated COVID-19 community levels across the nation for the previous week. And on a positive note, the map is turning greener, reflecting around 51% of U.S. counties with low levels, 36% with medium levels, and only 13% with high levels. Next slide, please. This figure shows the proportions of SARS-CoV-2 variants by week, and since late June, the BA.5 Omicron lineage has increased in proportion and is currently the cause of 85% of cases. Next slide, please. And now moving on to our monkeypox update, or MPX as I'll refer to it as throughout the presentation. I'll provide some quick information on the state of the outbreak. Next slide, please. There have been a total of 24,572 reported cases of MPX in the United States. The lighter color on the map indicates fewer cases, and the darker color, the higher number of cases, The jurisdictions currently with the highest number of reported cases include California, New York, Florida, Texas, and Georgia. Next slide, please. This figure on the slide shows both daily MPX cases in red and the daily 7-day average line overlaid in blue. And we can see that average number of cases have been trending downward since late August. Next slide, please. On this slide, this has a link for information about MPX in specific settings, such as congregate setting. Next slide, please. And then I'm excited to share that our toolkit for MPX information for people experiencing homelessness posted just today, and it compiles all the pertinent links for MPX information that people experiencing homelessness or people serving those experiencing homelessness may need to reference, as well as some unique considerations for this population. Next slide, please. And with that, for any more information or questions, please contact CDC at the number listed, and I'm happy to answer any questions in the chat. So back to you, Norm.
Thank you so much, Carolyn. Can you talk about we're very excited about the toolkit, and do you have any sort of plans to do more sort of rollout or more sort of advertising and publicity around that monkeypox guidance?
Yes, definitely. We are hoping to have a webinar on it so we can go through the details of the toolkit, as well as any other pertinent toolkits that come out for related populations. So be on the lookout for that. We will definitely be publicizing it.
That's great. And where can people like sign up for a listserv or check on your website to learn about upcoming webinars and things?
That is a very good question. I will post in the chat where people can find that.
Great, thank you. And if you are signed up for the Hud Exchange listserv and the Hud listserv, we will also publicize that through our listservs. So thank you very much, Carolyn. And if you have any questions about anything COVID or monkeypox related, please go ahead and type them in the chat window. But next, we are going to move to an update, as you can see on the screen, about ESGCV. So I'm happy to turn things over to Heidi Schulp and Karen de Blasio, who are going to walk us through how we're doing on that front. So Heidi, I'm going to turn things over to you.
Perfect. Thank you so much, Norm. Next slide, please. It's been a little bit since we've talked about IDIS on these webinars, but wanted to give a quick update on where we currently stand. As of today, over 70% of our communities are over 60% drawn and doing really, really well with their draws in terms of IDIS, because that's what I'm looking at, not necessarily expenditures reported in SAGE, but just focusing on the draws in IDIS. We have 6 communities or recipients right now that are completely 100% drawn in IDIS, which is just great to see. We're getting a new community usually every other week or so that is crossing into that threshold. So it's really, really great. Right now, the overwhelming majority of our grantees, as you can see on this table, are doing wonderfully and are well over 50% drawn. We do have a small number of communities that are still below 50% drawn. And so, hoping that those communities are able to, get together their activities, get together and start making significant draws in IDIS. Next slide, please. Just a few quick reminders. All of the grant reductions that have taken place, either your community didn't meet the 20% expenditure deadline from last September, or your community didn't meet the 50% draw deadline from June of this year, all of those grant reductions have occurred in IDIS. And so if you are one of those communities that had your grant reduced in any way, shape, or form, it's probably a good idea for you to log into IDIS and confirm your activity funded amounts. There's no prescription, there's no formula as to which activities you need to reduce. That's a decision that is up to you as a community. But you do want to probably go in and just confirm those activity funded amounts, make sure that they're accurate for your current standing. Additionally, if it's also a requirement for both ESG and for the ESG CARES funding that you are, as a community, you draw quarterly from IDIS. And so we have seen right now that we have 49 recipients that haven't done a draw in IDIS in over 90 days. And that timeline really aligns with that mid-June 50% draw deadline. So there's quite a significant number of communities that haven't processed a draw since that deadline. And again, you're required to draw every 90 days in IDIS. You're required to reimburse your subrecipients within 30 days of a complete invoice package. And then, again, just making sure that that draw is happening in IDIS. And that way we're able to continue to follow along on everyone's great progress. And then finally, one of the things that we're seeing come through a bit more often on the IDIS Ask a Question desk on the Hud Exchange is communities have drawn from the wrong grant. So we know that 2020 is very, very odd in IDIS because you have two separate grants for your Emergency Solutions Grant Program. One of those grants is going to have a W in it, and I made a typo on this slide, so hopefully I'll be able to articulate this better. One of your grants is going to have a W, not an M, a W. And when you're drawing from your CARES grant, you want to make sure you're selecting the right one. So you want to make sure you're selecting the grant that has a W in it. And so again, that's just something we've seen happen more often coming through the Ask a Question desk, where we created a voucher, we approved that voucher, and we drew it from the wrong grant. There's not a way to make a very easy revision from one grant to another. So make sure you're drawing from the correct grant. Next slide, please. One of the other things that is coming up, again, we're seeing it through the IDIS Ask a Question. We're seeing it as we're working with communities. Make sure that your IDIS activity description narrative speaks to how your community is using that ESG funding to prevent, prepare for, and respond to coronavirus. We're still seeing quite a number of completely empty activity narratives in IDIS. So make sure your activity description is articulating, again, prevent, prepare for, and respond to coronavirus. There is this wonderful resource on the Hud Exchange that gives you sample activity descriptions for all of the different activities in IDIS, and that's linked right there on this slide. Next slide, please. And then finally, just wanted to give some resources that are currently available on the HUD Exchange. First and foremost, if you are a community that is going to be receiving reallocated funds, there was a reallocated funds grant webinar that was published in August 2022. So that resource is available for you now on the HUD Exchange. Again, if you are a community that either had grant reductions occur or are a community that will be looking forward to receiving reallocated funds, there is a fact sheet on the HUD Exchange for you that goes through, more of the mechanics of how to reduce an activity funding, then increase the second one, what to do with your administrative subfund. And I'm sure all of that wonderful IDIS detail that most people do not want to hear on a Friday afternoon. But if you do want to hear it at some other point in time, it's right there for you on a fact sheet. And if you love screenshots and you need all of that technical information, there's a link to the IDIS manual. We know that the Section 7 is getting a lot of attention with drawing ESG funds, how to create those vouchers, how to make sure I'm drawing on the correct grant, how to make sure I'm drawing for the correct subrecipient. So all of that information with lots of screenshots is right there in the manual for you. And then finally, if you really just want to see a workflow, a screen flow in IDIS, if that's the type of learner you are, and that's okay, and that's fantastic, there is the IDIS Setup and Draw webinar available on the HUD Exchange. If there are any IDIS questions, happy to take them right now. If not, I'm going to turn it back over to you, Norm.
Thank you so much, Heidi. We did have one question about the draw percentage chart you showed. So for recipients who had a reduction as a result of the reallocation process, is that reduction reflected in the denominator in that chart, or is this tying back to the original amounts?
No, so we are using that reduced grant amount in that calculation. And the reason being, as part of that 50% draw deadline, it was a 50% draw deadline on your reduced grant amount. So if you were a community that lost or had some funds recaptured from not meeting the 20% expenditure deadline last September, we used that lowered grant amount to ensure that you were, that calculation was on that grant amount and not your original award amount. So yes, it is being calculated on the reduced grant amounts.
And does it take into account also the recapture that happened, this summer?
Yes, because yes, all of those recaptures have happened,
Great.
And that would be the grant amount you would see in IDIS. So that's what we're using.
Fantastic. Thank you very much. And again, if you have any questions about ESGCD or IDIS, please go ahead and type them in the chat window. I will also say that if you have any questions when we're not in the middle of an office hours, you're welcome to submit them to the AAQ desk. We answer all kinds of questions all the time, and we are delighted to hear and answer your questions. Thank you very much, Heidi. We're going to move to the next part of our agenda today. We have a great TA resource, set of resources that we're happy to highlight here. So I'm pleased to introduce Ashley Kerr, who is going to walk us through some of those resources, including on winter planning and isolation and quarantine. So Ashley, over to you.
Thanks so much, Norm, and thanks to everyone for having me back on office hours to talk about winter planning, infection control, and isolation considerations. So I'd like to start with the old saying, an ounce of prevention is worth a pound of cure. It will benefit everyone if COCs and their member agencies consider winter planning now to be better prepared for when cold temperatures and inclement weather are here. Next slide, please. So our reality check. In many parts of the US, ESG-CV funds are no longer available to cover all of the costs associated with an ongoing pandemic. Most shelters and congregate facilities have not gone back to full capacity, so there are fewer beds for people to access when winter comes. And while we know that some hotels were great partners for the past few years, we know that most, if not all, are back in business and less willing to take people experiencing homelessness that need to isolate for extended periods of time. We also know that people are on overload, and this complicates an already complex infection control planning and implementing strategy. Next slide, please. So a few weeks ago, my colleague Brian shared some strategies about estimating need and how to develop and revise your community's winter plan. I'd like to talk today about one aspect of that plan, isolation considerations. We know the best approach is non-congregate shelter, and this can take the form of hotel or motel rooms or dorm rooms with individual and private bathrooms. If this is not feasible, the better approach could be to use medical respite care sites or single room occupancy buildings with shared bathrooms and eating areas, or repurposed residential facilities that are not traditionally used for sheltering households experiencing homelessness. So think decommissioned schools or other municipal buildings. Or maybe faith-based communities have really large rec centers or other places like that. If your community doesn't have options like the ones I just shared, then you will need to consider the good approach, which is to have a separate section within the shelter where residents who need to be isolated or quarantined can remain separated from other residents. Regardless of what approach you take, creating physical distance and improving air ventilation will help mitigate the spread of COVID-19. This, again, looks like beds spread further apart, options for people to be more than 6 feet away from one another, and encouraging time spent outdoors if possible. Shelters can run portable air filters and air purifiers, open windows and doors, and use exhaust fans in kitchens and other areas. And if for some reason you took away your COVID-19 cleaning protocols, make sure to reinstate those. The regular cleaning and disinfecting will help mitigate the spread of COVID-19, along with other contagious illnesses like the flu and MPX. Next slide, please. Your shelter can only be as effective if you have a team there to support your residents, which means that having a healthy team is as important as keeping your residents safe and healthy. So have staff wear masks and continue to encourage vaccinations and boosters amongst your staff. If your shelter must isolate residents on site, designate your specific team who are up to date on their vaccinations to support the isolation area. You're going to have to maximize physical distancing while supporting residents. So you're going to need to think about non-contact service delivery, for example, so telehealth options or other ways to maximize your physical distance, but also supporting your residents. Provide full PPE with N95 respirators for team members who are going to work in those isolation areas. And then limit the movement of those designated team members within other parts of the building. And of course, you'll see the link here, and I'm sure my colleague Brian put it in the chat, but there is an isolation in place document that goes through all of this information. And there's a good chance that your shelter will deal with multiple absences due to illness this winter. So just review the staffing shortages strategies document that's been published on the Hud Exchange, and do not hesitate to send team members home with no penalty if they show signs of illness, and make sure that they remain home until they are symptom-free and able to return to work. And of course, provide hazard pay or other bonuses. Let people have days off, encourage the team to rest and practice self-care. We all need to be taking care of ourselves and others on our teams throughout this season. Next slide, please. You have heard us talk about the Vaccine Toolkit. There are a ton of resources on the Hud Exchange. We know that vaccines help prevent severe illness and death in most people. And so it's really important for communities to connect people who are experiencing homelessness to available vaccines. We've always talked about COVID-19, but we also want to talk about the flu. And there may be situations, if people are eligible, to also get the MPX vaccine. Like I said, there's an extensive vaccine toolkit online. It helps you think about building vaccine confidence and increasing access and distribution of vaccines for people experiencing homelessness. It also has great information about pro-vaccine messages and common questions about the vaccine. So please be sure to visit that Vaccine Toolkit landing page for more information. Next slide, please. There are 7 resources on the Hud Exchange about MPX, and I'm going to go through each of these just briefly, but please take your time and look at them. There's some really good things out there for you. As Caroline talked about MPX earlier, there is concern that MPX will affect people who are living in congregate settings, and we know that there are active cases in shelters in different cities across the US. So although MPX does not transmit as easily as COVID-19, if someone contracts MPX, we know that the rash is painful, it's visible, and it takes a much longer time to fully heal and go away. Because of this, we want shelters in congregate settings to be aware of the signs and the symptoms of MPX and to know what to do if someone suspects they have MPX or were exposed to MPX. So the resources include working with local partners to prevent and respond to MPX. This is a guide to help establish initial conversations internally within your team and with local public health partners to really talk about necessary MPX prevention measures, including discussions about establishing pathways to vaccination, care and treatment, identifying available isolation spaces, planning for effective communication strategies about MPX, and then talking about accessing and utilizing local data to look at MPX trends. The preparedness considerations doc. It's very similar to the checklist that we have on the Hud Exchange for COVID-19 shelter protocols, but in this case, it helps think about MPX considerations, and there are a few additional pieces into that document that are really helpful. So it will help shelters think about their infection control protocols and how that can be incorporated into their existing policies and procedures. The commonly asked questions about MPX doc is up there as well. There are lots of questions that people have about MPX, and this document helps answer many of them, and it really can be used by your shelter team members to help answer resident questions about MPX or about shelter team member questions, including how it gets passed from person to person and what happens if somebody contracts MPX. The alternative approaches to isolation and quarantine, that was the doc that I talked about earlier in my slides, but it's that good, better, best approach to what isolation and quarantine can look like in your community. For outreach teams, we have a fillable flyer that you can customize for your own community. But outreach teams are probably going to want to communicate about MPX with people who are living unsheltered in their community. This is a postcard size flyer. Again, it's customizable. You can print it out. You can hand it out to people who you are working with, who are living on the street or in encampments or in other places not meant for habitation. And then these 3 flyers, MPX info that you should know, protecting yourself and others from MPX, and what to do if there is an MPX case in the shelter, are designed to help shelter residents and team members know more about MPX and what to do about cases. So they're really designed to be placed on bulletin boards, in break rooms, and can be passed out to individuals as flyers if you want to do so. Next slide, please. Okay, just a few more resources. Again, these are all on the Hud Exchange. We just wanted to share that these are the ones specific to winter planning. Brian went over these a few weeks ago, but again, gentle reminder, an ounce of prevention now is worth a pound of cure. So please think about preparing now. It will really help save everyone's stress levels when another surge occurs. So the Winter Planning Guide overview helps identify collaborative partners and links to the resources, including that activation and communications planning guide that provides a key set of decision points and a guide for the preparation process. And then, of course, all of this can be found on the winter planning landing page. So please go and visit that. Next slide, please. Thanks so much, everyone. We hope that these resources are helpful. And if there are specific resources that you need in your community, please let us know. Back to you, Norm.
Thank you so much, Ashley. And I just want to echo Ashley's many comments about the importance of vaccination and how important it is that I know we put in a lot of work on helping people get vaccinated, but this is an ongoing effort and it's just incredibly important. Whether it's people who have never been vaccinated before or who need boosters, or being vaccinated against monkeypox or other infectious diseases, just incredibly important. And I think we've learned over the past 2.5 years about just how big a difference it can make. So thank you very much, Ashley. So we have a few questions we're going to dive into. First of all, many of you are probably aware that there is a deadline coming up next week. The Continuum of Care NOFO is closing next Friday, September 30th. So we did have a couple questions we wanted to address related to that. So Brett, I'm going to send this one over to you. The question is, in the rural set-aside for this, so this isn't actually the COC NOFO, this is the special NOFO on unsheltered and rural homelessness. But it says that rural projects can apply for construction, rehab, or acquisition. In eSNAPs, it says that only PSH projects can apply for these funds. Can you clarify about what, if any other kinds of projects, for example, rapid rehousing or joint transitional and rapid rehousing, can apply for construction, rehab, acquisition as part of the rural set-aside? So can you walk us through that, please?
Sure. So you have, when you're looking at the unsheltered NOFA, you have to think about the COC regulations in addition to what's allowed in the unsheltered NOFO. And so while the NOFO permits acquisition, new construction, and rehabilitation for rural set-aside projects, it's actually the regulation that further says when they can be used. And so under the regulation, you can use acquisition, new construction, and rehabilitation for permanent supportive housing, and you can use acquisition and rehabilitation for facilities that will be used to provide supportive services for program participants. So those are the only 2 instances in a rural set-aside where you're going to be able to carry out the costs of acquisition, new construction, and rehabilitation. So you cannot do it in rapid rehousing projects, and you can't do it in the joint component projects because the NOFA specifically sets out the eligible activities in joint component projects.
Thank you. And also in rapid rehousing projects, the units are tenant-based, so you do have to give program participants the choice of sort of existing units on the market to rent from. So thank you very much for walking us through that. We have a separate question that I want to go ahead and take about FMRs are not keeping up with rates landlords are charging now. This has caused shortfalls in projected revenues for the current grant year. Is HUD planning to adopt current FMRs and adjust or amend current grant agreements so agencies can meet their current obligations? So just a quick note about how FMRs work. They're sort of used for two different things. One is to determine how much you're allowed to pay for rent in a leasing project, generally in a leasing project. For rental assistance projects through the Continuum of Care program, you don't use FMRs, you use a rent reasonableness standard. But we do, for leasing projects, use FMR as the maximum. And you can always use whatever the current FMR is at the time you are leasing up the unit. And then we also use FMRs to determine the grant amounts. And we always use the FMR that's in place at the time the application is due to HUD. So that does often put us behind where we are with the current FMR. So for example, if you receive funding for fiscal year 2021, we use the fiscal year 2022 FMR in those cases. But a lot of those projects are going to be operating for a significant amount of time in fiscal year 2023. We do not update the FMRs. We don't have any money to do so or any authority to do so. So we do not update the grant amounts when there is a change in FMR. It's always connected to what FMR was in place when you submitted your application, or actually when the application was due to HUD. Lastly, I wanted to throw a question over to Ebony about cases where a COC, so I mentioned there's a deadline coming up next Friday for the COC application. If a collaborative applicant is having trouble or a project applicant is having trouble submitting their application for any number of reasons, can you talk about what steps should they take if they're having trouble submitting their application?
Yeah, so just another reminder that the applications for the COC competition, are due September 30th at 8 p.m. Eastern time. So before then, if you're finding that you're having a hard time submitting your application, please submit a question to, or the issue you're having to cocnofo@hud.gov. And I want to stress that you want to submit that as soon as you find out you're having an issue with submitting your application, because we start only responding to emergency support questions, and we will keep doing so up until the deadline. But if we respond and we need enough time for you to be able to go into eSnaps and complete your application. So you want to go to in our chat, COCNOFO, and that will and they will help you with your issue. But do so please as soon as you can, well before the deadline.
Thank you very much, Ebony, and I can't echo that enough. We had a question come in about whether there are bonus points for submitting an application early. Ebony already answered that. There are no bonus points, but you do get the good feeling of knowing that you have submitted your application, and it's hopefully a relief for you. So definitely worth submitting early, even if there are no bonus points available. So Brett, I want to send a question over to you. We had a question about some of the winter planning activities that Ashley was talking about, and their eligibility under the ESGCV program, and specifically, what is a recipient's responsibility for documenting that it's related, it's protect, prevent, prepare for, and respond to COVID? How does somebody document that in these examples? So do you mind sharing with us, and maybe even some resources about how people should think about that?
Sure. So The likelihood is that a lot of the activities that you're going to do under winter preparedness are going to be eligible for ESGCV because COVID is still here. We're still experiencing an economic something because of the pandemic. And so very likely you're going to be able to tie back most of your activities to what either preventing, preparing for, or responding to coronavirus. If you think about extra sick leave that Ashley talked about, or making sure that staff stay home. If you think about ventilation you might need to put in your shelters to help as more people come inside when it gets cold. All of that is going to be related to preventing the spread of COVID. As for documenting it, we did publish a resource at the very beginning, well, close to the beginning of COVID, and we can put that link in the chat on how to document it and which activities need to be documented at the project level and which can be documented at the activity level. And hopefully that will help.
Great, thank you so much. And it reminds me, we've been in pandemic mode so long, we probably have a lot of people who are new who weren't sort of in their current position when those resources were being developed. But if you go to Hud Exchange, we have a whole suite of resources that we developed as part of ESGCV and in COVID response. So certainly check out this resource, but we have a ton of other resources as well. If you haven't seen them before, or if it's been a while and you don't remember, it's definitely worth a refresher. I'm always surprised how much great stuff is in there. So that, well, we just had another question that sort of snuck in here. And Ashley, I wonder if you could talk about this. The question is whether a community could apply the winter planning documents and such to hurricane or other inclement weather situations.
I think so. I mean, it's really going to be determined upon the community. I will also point out that there's a really good disaster toolkit on the Hud Exchange. So we will post that in the chat. I was trying to find it quickly, but I will do that in just a second. And that can also provide some really good guidance for what happens with any kind of inclement weather.
Thank you so much, Ashley. I will also say we have a lot of individualized technical assistance that's available if you have questions or if you need help related to preparing for a disaster. So please feel free to reach out. Just type whatever you need in the technical assistance request, and we have a lot of experts. Unfortunately, disasters have been more frequent and of greater scale, and so we've had to develop a lot more expertise on how to address them. So please feel free to reach out. So that's all our questions that I can see that we're able to answer today. I want to thank all our presenters for jumping in here and providing all this great information. Carolyn, thank you for giving us a COVID and monkeypox update, and Ashley and Heidi, thank you for giving us updates on winter planning and on ESGCV spending. And I want to thank you all. I know we're coming down to the wire on the COC application, and almost all of you are applying also, I'm sure, for the unsheltered and rural NOFO, and I know it's a lot of work, and there's obviously just the regular work of ending homelessness that you're all engaged in. So thank you for joining us. We love hearing from you. So if you have any suggestions for us going forward or content you'd like to see in a future office hours, please just drop a note here or feel free to reach out to one of us and let us know what would be helpful to you. So with that, I want to wish everyone a great rest of the day, great weekend, and that concludes our office hours.